Hello again, ladies and gentlemen, and welcome back to the Founder's Playbook from Lab to Launch. Because, let's be honest, the typical startup advice doesn't work for deep tech founders. You can't just move fast and break things when your product has been developed over a decade of peer-reviewed research. You can't just follow the Silicon Valley playbook when you're navigating intellectual property with a university and trying to find capital for hard tech in a capital-constrained world. So where do you get the answers? You get them from someone who's actually done it. And our guest today is Saruni Tipatet, founder of VibraSpex. He's lived through that entire lab to launch journey, developing the technology, finding that first believer, and meeting the challenge of turning complex research into a product someone will actually pay for. Today, Kevin's opening up his playbook. No jargon, no fluff, just the truth about the mistakes made, the lessons learned, and the strategies that actually work. So, if you're an academic thinking of making the leap, or an investor looking for a good prospect, this is the conversation you've been waiting for. Kevin, how are you? Welcome.
Thank you very much. Thank you very much.
Good to see you, man, and lovely to have you on.
Thank you very much. Love to see you too.
So, let me, at the beginning, help people understand what it is you've been doing. So imagine you're explaining your company to an intelligent investor, but who doesn't know the technology, the detail, not an expert in your field. In simple terms, what is the major problem that you solve?
Yes. So, as we were at, early detection of cancer saves lives. And at VibraSpex, we're developing a laser-based technology that is coupled to machine learning, powered by machine learning, to identify signals of early cancer development that are usually very, very difficult to detect when the early stage. Most medical interventions are very effective. And this is done in biofluid, like blood.
So you're looking to identify cancer earlier.
Yes.
Number one, what I heard. And also you're looking to identify it in a way that is, would that be less invasive? Did I get that sense?
Yes. So exactly. So usually the gold standard, for example, of breast cancer is an invasive technique, well-established but invasive technique. The mammography that utilizes invasive radiation into the body. So we are trying to do a better job, but at the same time avoid this invasiveness to the person.
Okay. So the problem you're solving is better diagnosis and less invasive, which I guess means if it's less invasive, more people have those tests and therefore you get more cancer diagnosed anyway in that way as well.
So accessibility is also a big factor. So most people who would not have the access to these quite expensive and centralized facilities that are not really widespread, especially people that require screening but are in quite remote places. So our technology would then be able to reach these kind of people as a cost as well as a fact for those people.
Okay, so actually there's a lot coming out here. You're not just going to detect cancer faster. You're not just going to detect cancer in more people, but also those more people are going to be, means that people that can't quite afford what we're normally doing, and also in different remote areas. So you're spreading the net wider to many, many more.
Accessibility is something for chronic and deadly diseases, something not really addressed in the proper way, as I see, because quite a lot of people don't have access to the kind of care that they should get. And we have technology. So we're developing along that line of bringing cost-effective technologies to those who need it, and not just those who can pay for it.
Right. So this is about not just about diagnosis, it's not just about the individual patient, it's about access to care and equity in care.
Exactly.
Very nice. Very, very nice. Well, so there's lots going on there, and it's hard. This is obviously a highly technical area, right? This is a very technical, it's medtech, it's biology, it's science, it's everything. Before you were the founder of VibraSpex, what brought you here? How did you get into this field?
Yes, basically general interest and in holistic and personalized care and medical technologies since many, many years. That's what kind of drove me to be in this space.
So you've got a lot of interest, but hold on, mate. There's a lot more there because you can't just sit on the park bench one day and go, I know what I'm going to do. I'm going to get into cancer diagnosis. So all those stepping stones, that building of those incredible and highly complex skills that you've done to bring you here.
I think partly also seeing, I like challenges and seeing that certain things don't work the way we all customers to medical systems and care. So from that point, even before birth. So I think at some point you realize certain things should be done differently, and you'd want the same way you would wish for somebody, for yourself, you wish for other people as well. So, and we all have stories in families and friends and that have suffered from the effect of having cancer diagnosed, and especially when it's done later. So this was a journey for me. I think it's a long time. So I wanted to focus on my, everything that I can and try to see if I can bring in something different that could improve anything.
Well, let's say you've got a motivation there. You've got that empathy developing about everybody, as you say, has had someone affected by things like this. So there's a purpose, there's an empathy, there's a reason why. What about the technical side? What skills have you had to develop and how have you done them?
Yes, so I've always had interest in bioengineering, and I actively looked for place to advance that and to learn that actually from the beginning as an undergrad. That journey took me from the Eastern African country of Kenya, where a lot of vibrant and diverse people come from, and we have lots of talent in all bases, and we not only export presidents and movie actors and actresses, and we also have we have scientists. I came from Kenya, a journey to Germany, where I was able to access really good education, university education, bioengineering. That journey started there to develop interest, and then it took me all the way to Scotland in the north. So, so
it's quite a journey from Kenya to Germany to Scotland.
Yeah.
But you're absolutely right. I mean, the culture there in Kenya is incredibly entrepreneurial. It's the country in Africa that has the most entrepreneurial investment out of the whole continent at the moment.
Huge.
There's a lot of people coming out of Kenya that are doing a lot of interesting things. And then a journey of education, but also of different cultures. Kenya and then Germany and then Scotland gives you a lot of insight into who people are and how they are.
Exactly. Yeah, totally agree. It's kind of a melting pot of different cultures and interests, and to come together. And I embody that, and it's kind of really nicely harmonizing to channel that into VibraSpex.
Nice, really nice. So you've done that journey of education. You've also done that journey of cultures and different places. And you've also had that purpose around wanting to make care more available.
Yes.
And make it better. So bringing all that together, what was the moment when you thought that all that could combine into something?
Yes. Basically the tipping point of all that was sometime in the winter of 2018, while I was conducting a research study, which was based in cancer pathology division in a major cancer clinic in Scotland. So witnessing how the conventional diagnosis in a major clinic works, and having myself witnessed close family and family of close friends recovered due to this quite serious group of diseases, the problem of diagnosis that occurs later. So that was kind of the paradigm shift that made me consider leading an innovative project that would accelerate safely to where it needed. And that only made sense for me to think of a startup.
Interesting, because so you're faced with it, right? You were seeing it every day.
Yes.
You were seeing the human effects of what was going on.
Exactly.
Every day.
Yes. Not just at work, not just doing the project, but also around me, like friends, a family, so family of friends and relatives. So it kind of very present. So it created that paradigm shift during that time.
Okay. Did you go technology problem startup, or did you go problem technology startup? Where did you start in that thinking? Was it the problem that made you look at the technology, or was it technology that put the problem in front of you?
Yeah, basically the problem was there before, the technology. So in the process of pursuing a technological kind of a training, and being exposed to the medical diagnosis in a conventional way, that's when now the problem became the solution kind of met the problem in my mind. So, and not just in my mind, but this thing it doesn't happen just by one person. I think the great ideas are they kind of start somewhere, but at the same time, it's refined when you have a certain team and you kind of have the right people, advisors and mentors. So I happen to have a really fatherly figure mentor back then when I was in that pre-PhD phase, working in that clinical environment. And that's when the bridging, this fatherly figure was head of a project called an impact in developing implantable micro sensors for the monitoring of tumors in real time. And he was at the same time the head of department of the institute where I was adopted as a very early researcher. So having a guidance and a mentorship, and at the same time have this presence of this big problem that passionately, has affected you. And then, of course, you see the potential solutions in the system that kind of struggles to implement and adopt. So it kind of started to create those were the ingredients, I would say.
Talk to me a little bit more about the mentor. Was that person that made you think I could do something entrepreneurial? Or was that the person that made you think I should do something interesting in this field? What was the influence there?
Yeah. So this mentor was Professor Alan Murray, retired now, was the person who kind of mentored me into the academic research. So VibraSpex developed organically from the academic project that ended up becoming my PhD project later. But before even the PhD, I had that mentorship from the Professor Alan Murray that really instilled in me the motivation and the belief possible and to cover all possible angles and not to be limited. And that is something that really, I think, the blessing to have in the very beginning, especially in the beginning when a lot of things can go wrong. So I'd say that, the mentorship was quite key in shaping the academic path that then would later lead to the entrepreneurial aspect of it.
Nice. That whole thing about all possible angles. Talk to me about that. What was that about?
So I think the mentorship that I had, this fatherly figure, was very key and helped me understand how the ecosystem works. There are a lot of politics involved as well with projects, with funding. So having the right people on your side that believe in you despite the challenges from institutions or people have their own special interests. And so you need to be very careful how you navigate that.
With the guidance. Yeah. Okay, so you had that mentor, Alan
Murray. Yes.
Alan Murray. So you got that mentor, Alan Murray. He's helping you go through that process of academia, of research, of getting the granting and everything else.
Yes.
Taking that technical interest and translating it into a startup is quite the leap. So what was the tipping point that made you think, look, okay, hold on, I've got something here and now I can make a business out of it?
Yeah. So the proof of concept. So that happened during the PhD at some point where after navigating all the challenges that come towards proving a concept. So that PhD project, the proof of concept, that showed me that we can detect viable signals of early stage breast cancer, invasive stage 1A in blood plasma. So that was a big technological hurdle. And the result of that early proof of concept was an important kind of a step towards understanding that this is now the foundation that VibraSpex can build on.
So you had that proof of concept, you thought we can build on it.
Yes.
You decided to go to create a business. Proof of concept and starting a business. I'm going to ask again, because that's again, still a leap, right? We think this is going to work, but now I'm going to start a business. So one is research, but what about the outside world? How did that get engaged?
So the outside world get engaged at the proof of concept. There's a paper that I published, and that paper got a really interesting response. And I ended up having doctors and people that actually are really close to the patients, to people that need certain technologies, reach out to me and would have expressed their interest. So I think this is where I started to kind of get a validation of that, let's do everything to get the right R&D approach. And usually that is usually aligned with the people that are very close, or kind of the future adopters. So this is
So you've done that. You've done a proof of concept. You've done that technological hurdle. You've got over it.
Yes.
You've got some attention. You've done a paper.
Yeah.
But then all of a sudden, this paper is published, but you're doing a startup.
Yes.
With which you normally need to protect your intellectual property.
Yeah.
That can be a difficult navigation for a research-based piece, because on the one hand, you're expected to publish, and you've got to talk to people.
Yes.
On the other hand, you've got to keep that intellectual property secret.
Exactly.
Or protected in some way. So how have you navigated that?
That's a very good question, because that board was very difficult at that time, because you have that IP you want to protect, the intellectual property you want to protect, you should not publish. But at the same time, you want to publish so that you can get the kind of support that I ended up getting. So it was kind of a trade-off. You need to know what you publish and what you don't publish. So you kind of have to know, you cannot publish the whole recipe, let's say, for example, that is your whole IP. So you publish as much as you can publish and possible to publish to get the right kind of response, then leverage that with the IP that you already then developed in that process. So we ended up doing that, and you can then, now in my case, I ended up applying for IP protection in the US, a non-provisional patent that you can also link to that prior paper that is published and is connected to that now, let's say, the larger body of work. So that is possible, but I would advise everybody doing this to not just guess, just do some guesswork. I did a lot of thanks to some really good IP attorneys and advice that I got from really experienced experts. So there's definitely a trade-off there. You need to know what you give out and show out to the world, and at the same time, it's not always best to keep everything locked down and then nobody knows what you're doing, because you need to get support.
So you mentioned something important there, though, right? So you got some IP attorneys helping you out.
Yes.
And you also mentioned the getting protection in America. Now, as far as I remember,
yes,
the law in the UK is different from the law in the US.
Exactly. Yeah, exactly.
Now, maybe tell us how that works, because you already published something in the UK, but you managed to get protection in the US.
Yes. So in the US, you have a year grace period from a publication that you could then, within a year from the point of publication, you can then go to the US and apply for non-provisional protection, would then connect that prior paper that is published to that patent. So it's possible in the US, but that is not possible in Europe and the UK. But it is possible to then get that protection in the US and then have a priority that you can then transfer to the other territories.
Interesting. So you've then got some protection in the US. You've almost done it. You've done it almost too late. Not too late for the UK, but it makes it harder, but you've done it in time for the US, and you've got that protection there, and then that can then support protection in other parts of the world.
Exactly. And then, of course, if you do it right, then you could then file later on that would follow up filing that would cover other territories that would include the UK, which then you would consider thinking about other aspects of the IP that you didn't publish before. So it could be like a larger body of work. So it's a technical thing, and the legal IP related technical aspects that you need to really have guidance of good IP attorneys to navigate that.
So you've got that patent registered out over in the US.
Yes.
Now you're moving outside the university. Now you've got that paper published. Now you're talking to other people. Who was the first person outside the university, or outside the academic realm,
Yes,
that you pitched this idea to? And what was their reaction? What did they tell you? What did you learn?
Yeah, the first person that I pitched this idea to was a close family member. And I think they thought that I must be crazy. And I'm pretty sure they thought that I would be much better suited to finding myself like a normal 9 to 5 job that pays the bills, and I should just stop dreaming and come to reality. Previously, I had the mentorship that believed in me, kind of very strong personality that guides you and very, very influential. But one thing I need to say is, and this notice, that the non-believers are, for me, equally as important as believers, because I've noticed that non-believers are really, I personally have a way to take that energy from non-believers and channel it to become energy that I propel myself to doing exactly that what they don't believe I would do. So yeah, it's very interesting. But this family member that I mentioned about this project, and they thought that must be not to even think of doing something like this. But it's just the reality. You will not always get support from the people you would expect to get support from.
Yeah. Well, because people have different attitudes to risk, right? And they see that and they think, wait,
Yes.
hold on.
Yeah.
You're a highly educated man that can do almost anything he wants to. Why are you doing this?
Exactly. Yeah.
How have you identified your first potential customer, or have you validated the market need? How have you gone about that?
Okay, so that process actually, in my case, came in an unconventional way, not the way that an entrepreneur and you kind of go and reach out to the market and try to see what would fit. It was more like from that specific paper, actually, somebody linked through somebody that would apply or would then apply that technology or adopt that technology would reach out and quite interested. And this person actually ended up becoming a medical doctor that ended up becoming a key opinion leader for us and a mentor. And I always have this person in consideration when we are having meetings and like development kind of discussion. So that the product, whatever you're working on, should be something very closely developed with those that would actually then adopt it.
Absolutely. If you're not working with the people who are going to adopt it, one thing you can guarantee, you're not going to get it in a way that they would adopt it.
Exactly. It's very difficult here to read their minds. So it's always good to have them telling that. And because they're practicing it, using maybe your competitors, they're using conventional stuff that not always works so well. And so in the medical sector, there are quite a number of things that don't really work the way they should. So if you want to improve anything, it's always good to work with people that actually apply those and that have direct contact to people that are affected by these technologies.
So you're working with people who would use it.
Yes.
How have you built something that they can try? Have you built a prototype? How have you done that? And how have you financed it?
Yes. So we're currently in the process of building a prototype, call it the version 2 prototype that can be tested by the real world case. And at the moment, we are thankful to have received some few grants, awards, and our personal contributions as well. And yeah, so that's how we're staying afloat.
Right, so there's still the grant route, because this is a medtech, right? It takes a long time to get through the process.
Yes.
It's not like a bit of software out of Silicon Valley where you can just turn things around in a day or a week.
Exactly.
This is years of journey to get through all the regulation, the approvals.
Exactly. So yeah, in our case, we've chosen the strategy of trying to leverage as much and then trying to utilize as much as we can from grants. And as we build these initial steps, and then in the future, we might consider other ways as we scale up.
So far, it's been grants.
Yes.
Have you looked at yet into any other sorts of finance, or is it too early for you?
We've looked. So we're also very lucky to have a partner in the US, a Silicon Valley-based partner, a VC that actually incubate similar projects and startups and supports their growth and expansion, so and scaling up. So we are very lucky to have been found by this organization that then we've made an agreement that covers the ongoing development and future scaling. So that's really helpful because it's not just future, it's also now, and there's mentorship and there's guidance because we all have the common vision. So yeah, really helpful.
That's really nice, because you've hit on something now that I think it is worth exploring a little bit. Not only their VC, it's not just money. It's guidance and mentorship and support and common vision.
Yes. Yes.
It's someone that you can work with. And it sounds like you're happy to work with for the long haul, because that's what it means when you've got an investor, right?
Exactly. Yeah. It should be a partnership. It should be shared values. It should be common goals and common vision. And yeah, a person or an entity that you really resonate with and you align and head together in the same direction. So we are lucky to have that on our side and the expertise and experience and contacts, network, super important.
Really nice, really nice. You're not just getting money, you're getting a co-owner, you're getting a partner, you're maybe even getting a board member.
Exactly. Yeah. Sometimes a really good piece of advice is worth more than money. So,
yeah, absolutely. Okay, so it can be a long journey though, finding funding. But how do you find the process? You're applying for grants, sometimes you get them, sometimes you don't. Sometimes you're thinking, I've only got 6 months of money left. How are you finding that process? And how do you deal with the stresses and strains of it?
The process is very stressful. The process of trying to get that grant. And grants are not really easy to get. Highly competitive, a lot of them. And they take ages for them to process, because as you imagine, a grant would have probably thousands of applicants, and they're just humans like you and me sitting behind the desk and looking through all these interesting projects. So I think it takes ages, first of all, and in this time, things are moving. So it's not a fast process. It's a very kind of lethargic, but if you do it right, if you plan it properly, put really nice milestones, and you have something going on, you can work on something while you're expecting something, and while you're expecting it, also expect not for it to happen, because you're not the only one. And humans decide. So you might have a really hot project, but somebody will go with something else because they are from that field. Or if you're, so it's at the end, it's humans deciding. You will not always be successful. If you're successful all the time, then you're very lucky. But don't expect luck all the time. Be ready to use to get there.
Yeah. It is just that process of, it's not just a quality name, but a quantity game. You've got to keep going, keep applying to get it going.
Yeah, exactly. So look for ways to keep going. Don't just stagnate and trying to get the grant. Find ways, reinvent. Every day is a reinvention, and try to find ways that you improve and moving forward.
So who's the team now? Is it just yourself? Do you have co-founders? I've heard about the VC being an advisor. How have you pulled yourself together as a team?
Yes. So initially, as I mentioned earlier on, the project started with myself alone, and a long startup, but not at the company level. While the company was being formed, I had already formed a small group of people that I've worked with even previously during the research times, and get along very well, friend, colleague, and we bring values together, not just the values that come into the company professionally, but also personally. But we are like 4 at the moment, like the core members of the team members. But then we have this other layer, covers advisors, mentors, partners. They're also part of the team, but kind of consider outer protective layer, supportive layer.
Very nice. The outer supportive layer. Very modern as well, because businesses now are very focused on what they do, but they have an ecosystem that is around them that supports them and connects them.
Yes, exactly.
It's a very modern way of working. Yes. So, but at the moment, you're the sole founder.
Yes, I'm the sole founder. Then I have a team that came in the process.
Very nice. Very nice. So you started with some of the lab work and also experiencing the issue. You've come through. Now you're building a prototype. You've spoken to users. You've understood the use case. You've got yourself connections with the VC in America, and also you've got patents. So you're building the building blocks, right? It's all coming together.
Yes.
Looking back across that, we know medtech in particular is a long journey, and you've got the regulations to go through and so on and so forth. But looking back along what you've just described, and the decisions you've made and the processes you've kicked off, is there anything you could go back and maybe, is there a decision you would change if you could?
Not really. I believe that everything happened the way it should have happened, and I don't really feel like there's anything that I would want to change. So I think it was a process, And not everything was perfect, but it's a learning process.
So you've gone through a process, you've learned. The whole point about the mistakes is that's fine because you're learning from them, because that's the development process you have to do.
Yes. Yes.
Yeah, very nice. And again, so this has been 6-7 years, and there'll be more years to come. It's medtech.
Yes.
Therefore, what have you learned that maybe wouldn't be Silicon Valley, wouldn't be the software approach? What's been different about this sort of journey for you?
Yeah. The one thing that I've come to notice is that the growth is kind of a hidden gem that is submerged in the noise, in the constant noise of daily constant activity. So the growth is somehow submerged there. So if you have a way to notice that, then you'll keep on growing.
You'll keep on growing. So there's a lot of personal growth in this. There's a lot of movement in the person as they experience all this stuff. So that's interesting. You can see where you're going, because it's not an easy journey, right? It's not easy. And I guess you've got to keep an eye on, well, hold on, but this is actually moving, and you've got to have a sense of that progress as you go. So thinking about that growth and that journey, is there anything that you would recommend to somebody else starting out? Any tool or book or paper or something that you would say, look, this has been useful for me. This helped me do something?
I wouldn't recommend a specific thing or a specific book. There's so many books out there. There's so many so many books that kind of try to put all this together, but specific one for investment and all that fundraising is venture deals. I would not recommend a specific book. I would say try to, and especially now in the world of information coming together and easy access to information, I would say make a list of questions and always try to answer those questions. Be critical. One can use the AI tools that can really get us so many sources of information. A good AI tool that is well trained will help you to pull together a huge amount of information about what's going on, what has happened before, what is going on now, and a really good amount of prediction of what would happen based on what has been happening. So I think you can learn a lot, and you can also kind of predict to a certain degree a lot. Yeah. So.
Okay. So use the tools around, but also be critical. Make sure that you've got the right the questions you're asking.
Yeah. Be very critical. This is a very important point, because whatever you're using, if it's your own brain or you're supplementing with artificial technology, but both brains needs to be critical and not just be fast at giving out answers, because you can have that process of giving out answers fast, but it has to be controlled. It has to be a good level of critical thinking that's involved. So kind of an iteration of questions and critical answers, critical thinking, and then questions and critical thinking. So it's like up and down fluctuation.
Very nice. Very nice. And in fact, it's really important in the age of AI, because actually it's not about the answers, it's about the questions and being able to work out whether they're good answers or not.
Exactly.
Yeah, really nice. Okay. So now you're going to put out the second prototype. You've got a relationship with at least one VC. What's the next big milestone? What's going to happen next for VibraSpex in, let's say, the next 12 months?
Yeah, so in the next 12 months, the biggest milestone will be, of course, the version 2 prototype ready, tested, and ready running. And then, of course, we aim to, within that time frame as well, start the clinical validation study.
So clinical validation, which I know is the beginning of that long road, right? And get the clinical approvals to actually be able to use this thing.
Exactly. Exactly.
So for any investors, any partners, potential partners, any future employees, anybody at all, what is the challenge where our audience can help you?
I think if anybody who hears this and they feel that we would share the same kind of vision and direction and be part of the team in any way, shape or form, happy to reach out to, and we could discuss and how we can build this together. So this is not just me and the team we have. I think the real growth is when we all pull together and the right people in the right direction. So I think it's going to make the biggest difference.
Very nice, very nice. So if they want people to follow your journey, people to find out what's going on, how do they get in touch with you?
Yes, so reach out to VibraSpex.com, see what we're doing. Reach out to me on LinkedIn, but have a look in our website, VibraSpex.com. And then, from there, if anybody's interested to be part of the team or to be in any way or to support in any way or just to be interested for information of what we're doing, feel free.
Lovely. So it's VibraSpex with an X at the end.
Yes.
.com. And ladies and gentlemen, that will be in the show notes, as will Kevin's LinkedIn profile. We'll have you there as well. So you can get in touch with him there. Kevin, thank you so much. Really interesting, because it's a different journey when you're doing medtech. And people sometimes don't realize that. But that whole piece around the long-term work you've got to do for medtech, also the patenting, also the early conversation with VCs, thinking internationally. There's lots of interesting stuff there for people to grab hold of, and ways in which you've done it just a little bit differently that will help you as you move forward.
Yes, exactly.
So lovely to see you again. Lovely to talk to you. Kevin, thank you very much for coming on. Much appreciated.
Thank you very much, Neil, for having me. Thank you. Appreciate it as well.
Kevin Tipatet, everybody.